Do you want to know 3 keys to clinical success and what you can do to improve in each of these areas? Then listen in to today's episode as I discuss 3 keys to becoming a better clinician. Learn practical suggestions on how to improve in these areas and develop the skills that will positively impact your success with your clients.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this episode. And today I want to talk to you about 3 things to help you have greater success in your clinical practice. And I hope you listen to this podcast to learn and to continue to grow your knowledge of your skills, and also learning to grow your own self as well, because we need to be better people to do better work. And so today I'd like to talk about 3 things to help you to have greater success in your clinical practice. And the first thing is really having a clean, clear, loving intention as you work with your clients. That needs to be your primary focus when you go to meet your clients and you're working one-on-one with them, is to set that intention to be of greatest service to this person in front of you. And you do that by being as embodied and as grounded in your own self and your own being, opening your heart to allow love to permeate and radiate from you, and allow that love to flow through in your hands so that you have a very loving touch. So when your hands are placed on someone's body, any part of their body, they can sense and feel that love. So that is, and that takes a lifetime. So please don't know that that's something you just can turn on overnight. But if you can start to set that intention with your sessions, I think you're going to find greater success no matter what you do, because it truly is that loving connection that creates healing, and love is the ultimate healer. And if you can offer that in your sessions, you're going to find greater success there. Now, these next 2 things actually come from the experiences I've been having in my classes and teaching live and in person. And I was surprised to kind of do a little research on some of the other companies out there teaching. And there really aren't that many live, hands-on courses being offered in person anymore. And that really has me sad, because everything's online, which is great. Don't get me wrong. But there are some people, and I would say, especially if you're newer to pelvic health, it's super important that you take those live and in-person courses to help with your education. Because some of the things that I'm noticing in my own classes is just the lack of skill in being able to palpate the body, and also the lack of knowledge around anatomy. And so anatomy and palpation skills are 2 of the biggest pieces to the puzzle that you really have to embrace in order to be a very successful, skilled clinician, in my personal opinion. And I think that's part of the success that I've had is, Nicole Cozine says anatomy is research, right? So anatomy is just is what it is. And we as practitioners, no matter what your licensure is, whether you're a body worker, massage therapist, chiropractor, PT, OT, anybody, midwife, you need to know your anatomy of the body. And if you don't know it, get out your anatomy books and start looking at it. And that is how I've developed a couple of the skills that I teach in my classes, is just going to the anatomy books and going, I don't like how this is currently being taught. Psoas muscle is my example here. I do not like that anterior approach to the pelvis or to the abdomen. And digging down through the abdomen to reach that psoas muscle has never felt good in my hands or in my body. And so I just got curious and said, how else can we approach and help support this muscle? And I went to the anatomy books, looked at it. I had also taken an online course through Katie Bowman all about the psoas muscle and learned so many interesting facts about it. And I then looked at where it inserted, and then figured out how, for a hand placement, how to access those points. And no, we can't physically touch it directly, but we can intend to it indirectly with our hands and use that intention to affect change in that muscle. And so that is one of the ways that I used anatomy and the anatomy books to help me to figure out a better way to affect change in a structure, because I didn't like what was currently, being used out there. So I want to give everybody permission, number one, to crack open those anatomy books and know that our body is more than bones and muscle and fascia, and that we must know the anatomy, and we must know the origins and insertions of all the muscles and all the bony landmarks in the body. And we also need to know the anatomy of the organ tissue too, and the blood vessels and the nerves and like all of it. We need to have that understanding in our hands and in our brains so that we can make the most effective change. Once you understand the anatomy and you're putting your hands on someone, then it's using that palpation skill to use that palpation skill to understand what it is that you're feeling between your hands. What structure am I on? What am I sensing? Because no matter what you're feeling, whether you're feeling a stuckness or frozen tissue or trauma or just held energy or increased tone, whatever you're feeling between your hands, you got to understand what you're on and what structures you're impacting with what you're doing. And so please give yourself permission, get out those anatomy books and really start understanding what is where in the body, and then start practicing and working on your palpation skills. You must, if you are a pelvic health physical therapist, occupational therapist of pelvic health, you must know the anatomy and the landmarks and how to palpate these landmarks in the pelvis. Game over. That's it. You must know it. So please start practicing on everybody that you work on. And even if you don't need to know it, start palpating. You need to know where the PSISs are. You need to know how palpate the sacral sulcuses, the ILA, the inferior lateral angle of the sacrum, the tailbone, the iliac crest, the ASISs, the pubic bone, pubic rami, all of those bones and all of the spinous processes internally, ischial spines, internally, ischial tuberosities. You need to know how to palpate and find those in every single person that you work on. Dead stop right there. That is a must. So I have an exercise for you. If this is not a strong suit for you, I encourage you, if you can, find a partner, find another body worker, another therapist who understands anatomy. And there's a 2-part exercise I want you to work on with them. The first part is to name a structure, and you could have your partner name it and say ILA. So you both know that you are looking for and palpating the ILA, and your partner can help you then find it on them. And then you can both say, yes, that's it. Okay. So one is, or you could say, I'm looking for your sacral sulcuses. And then you go palpate and you go, I think they're here. And then your partner can hopefully give you feedback as to whether you're on them or not. So that's the first step to the exercise. Then the second step of the exercise is you palpate a structure and your partner has to identify what structure you're on, and you need to make sure that you're both on the same page and that you are palpating the ILA and they say ILA. Okay. So that's the second step to the exercise. And please practice this. Every body is different. And one of the most fun things I love doing in my live courses is we do an assembly line. And we have however many tables we have in the room, we have people lay on those tables, and then everybody else palpates and does 3 different techniques and handholds. And we do one technique, then the next technique, and the next technique, all on that person. And then we rotate to the next table and we do those same 3 techniques on that person. And then we rotate to the next person and you do it on that person. So then you get an opportunity to practice palpating on different bodies the same techniques, so that by the time you go back to the clinic when you go back to the clinic, they are in your hands and you're confident and you feel comfortable knowing how to feel for them, because usually every class has different body types and you learn how to palpate on someone with a lot of tissues. You learn to palpate on someone nice and petite, and it just, you get the gamut, because that's what shows up in your clinic, and you need to be able to feel comfortable palpating every single person that lays on your table. And so if you are a pelvic health therapist, you need to know not only how to palpate and know the anatomy of the pelvis, but you also need to know how to mobilize and manipulate the bones of the pelvis. And if you've been following me for any time at all, you know that there is more to the pelvis than just anterior and posterior rotations, especially in a postpartum person. The pelvis goes into motions that are not physiologic in our natural movements. And you need to understand and know how to manipulate and mobilize these bones back into their normal space, know how to get good springy mobility in all of the pelvic bones for normal functioning of the pelvic floor muscles. So the pelvic bones and the pelvic floor muscles are also greatly influenced by the pelvic organs. So if you're a pelvic health therapist, you must know about the anatomy of those organs, and more importantly, know how to manipulate and mobilize those pelvic organs, because I have just learned that those organs are king. And while I haven't quite determined fully yet whether working with the organs first and then the pelvic bones, or vice versa, which is more um, effective, I'm not sure it quite matters yet, because I do know that pelvic organs can influence the pelvic bones. The pelvic bones can also influence the pelvic organs too. So try one way and see if it works great. If not, try the other way and see. So I haven't quite put my stamp on which way is most appropriate. Visceral manipulation will teach the pelvic organs first. I have had success working with the pelvic bones, then the pelvic organs, and vice versa too. So just know that we need to be able to manipulate and work with all of them in order to have greater success with our clients. So you need to know how to palpate the pelvic organs externally and internally. You need to know how to affect change in all of the ligaments that support those organs and where they attach to on the bones. Because if you really start to palpate and feel what's going on in the bones of the pelvis, where there's greater tension or hardness in the bone, a lot of times that will correlate with where the organs, the ligaments attach to. And so then you know you have to work with both in order to get really effective change. So everything is tied to everything. The toe bone is connected to the shin bone, connected to the knee bone. You know that song. It's so true. And we need to be able to make effective change by addressing the whole system and not just focusing in on the pelvic floor muscles themselves. So in fact, the protocol I teach in my courses, the muscles are the last thing that I treat. You've got to treat the bony pelvis. You got to treat the organs and the ligaments that support those organs. And you got to deal with the fascia and any scar tissue. And then you can address the muscular function of the pelvic floor muscles. And when you are working with the pelvic floor muscles, it's way more effective if you use the pelvic bones along with using the bones to mobilize the bones to allow the pelvic floor muscles to relax on their own. You don't have to put a lot of pressure on the muscle when you use the bones. So there's just so much that is important for you as a body worker, as a therapist, wanting to make effective change in the body. You must have that loving therapeutic presence in your body. You must understand the anatomy. And I so appreciate Barral Institute's visceral manipulation courses because they do such an excellent job of teaching you relationships and how one organ is affected by the other and the connections up the body. The bladder has a ligament that attaches into the liver that goes up all and connects all the way up into the cranium. There's pathways in the body where everything is connected. So please know that the more you can understand your anatomy and how things are connected, the more I think you're going to be able to understand what you're actually feeling in the body and why the body is doing what it's doing. So no more anatomy. Get that knowledge into your brain and into your hands and learn how to palpate the body. No, you've got to be able to, what's great about it is you need to know how to palpate a structure and you need to know where the structure is in the body. And if you can't touch that structure, intention is a big part of the puzzle as well. But you have to know what to intend to in that area to be more successful. So please do your best, study your anatomy, work on your palpation skills, and let's all be better therapists for our clients. Thanks so much for listening in, everybody, and we'll see y'all in the next episode. Here's to smoother births and faster recoveries. Take care.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.